Welcome to this episode. Let me start with the question. When a hospital introduces a new digital system, say an AI tool to support diagnosis, or a platform that lets patients consult their doctor by video, what do you think happens next? The optimistic answer is care improves, workloads reduce, everyone benefits, and sometimes that's true. But in my research, I kept finding that digital transformation in healthcare almost always produces something unexpected alongside those benefits. Something that wasn't in the plan, a tension, a contradiction, a situation where two things that are necessary pull in opposite directions at the same time. We call those paradoxes, and they're everywhere in digital transformation. A paradox is different from a problem. A problem can be solved, you identify it, you fix it, you move on. A paradox doesn't go away. It's two demands that are contradictory but also deeply connected, and you have to keep navigating between them over and over rather than resolving them once and for all. Think of yin and yang and how they complement each other. Or think of change and stability. Both are right, both are necessary, and they will always be in tension. So for this research project, I studied the paradoxes of digital transformation in the context of healthcare. And how did I study this? Let me explain it as simply as I can. Imagine you have a big pile of research studies from hospitals, clinics, and healthcare organizations around the world, all looking at what happens when digital technologies are implemented. I went through thousands of those studies systematically, filtered them down to 29 that specifically captured the lived experience of people inside healthcare settings navigating digital change, clinicians, nurses, patients, managers, and I read them carefully, looking for patterns in the tensions they described. That process is called a systematic review and metasynthesis. Think of it like being a detective who reads every witness account carefully, looks for what they have in common, and builds a picture of what's really going on. I ended up with a map of 5 types of paradoxes that keep showing up across different contexts and countries. And for each one, I identified approaches that help navigate them. Let me walk you through each one. The first is what I call the paradox of digital disconnect. Digital technologies can enhance care. They give patients more access, more information, more flexibility, but they also create distance. The personal touch that makes healthcare feel human, the eye contact, the physical presence, the sense that someone is truly with you, can erode when interactions move to screens and platforms. A nurse who once sat beside a patient now monitors them through a dashboard. A GP who once read a patient's face now reads a message. The approach that helps here is what I call adaptive innovation, a continuous process of redefining roles so that technology enhances human interaction rather than replacing it. It requires ongoing negotiation. How do we use these tools without losing what makes care feel like care? The second is the paradox of tech-induced burden. This is one that resonates far beyond healthcare. Technology designed to make work easier often makes it harder, at least for the people using it. Electronic records that were meant to save time now require clinicians to spend hours on documentation. Platforms that were meant to reduce workload create new roles, new expectations, new pressures, and most importantly, those new responsibilities often aren't formally recognized, paid, or even acknowledged. The approach to navigate this paradox is human-centered empowerment, involving healthcare staff and patients actively in the process of technology adoption through participatory decision-making so that the people most affected by the change have a voice in shaping it, and embedding that participation in institutional policy, not just good intentions. The third is the paradox of technology implementation. When a hospital decides to introduce a new system, it faces a tension between experimentation and planning. Short-term trials are necessary. You need to test whether something works before committing. But at the same time, healthcare managers need long-term stability and clear goals. These two modes of operating are hard to run simultaneously. Add to that the complications of data sharing versus privacy protection, and integrating new systems with old ones that nobody wants to throw away yet, and you have an organizing challenge that doesn't resolve. It just has to be managed. The approach I propose here is strategic agility, using flexible, adaptable routines that allow for real-time adjustment while keeping the organization's core identity intact. Healthcare organizations that navigate this well don't pretend they can plan everything in advance. They accept technological uncertainty and build in the capacity to respond. The fourth is the paradox of technology co-creation. There's an inherent tension between technology providers who want scalable, standardized solutions and hospitals that want something tailored to their specific needs and workflows. When those two groups try to build something together, power imbalances and conflicting priorities emerge. The IT department views the tech provider as a rival. The medical staff sees collaboration with external partners as more effort than it's worth. The approach that works here is collaboration for user-centric design, prioritizing the real needs of end users through iterative feedback and horizontal partnerships, where no single stakeholder controls the design process. And the fifth is the paradox of multi-stakeholder collaboration. Healthcare doesn't happen in one organization. It involves governments, regulatory bodies, technology companies, insurance systems, universities, patient advocacy groups, all with different interests, different timelines, and different definitions of what success looks like. Aligning all of those actors around a shared vision of digital transformation is quite difficult. Regulatory frameworks that are meant to protect patients can block innovation. Government initiatives that are meant to drive change can create bureaucratic obstacles. The approach here is collaborative alignment, creating spaces where stakeholders can negotiate, learn together, and build enough shared vision to move forward without requiring everyone to agree on everything. What ties all five paradoxes together is a simple but important insight. Digital transformation in healthcare is not a problem to be solved. The tensions are persistent and in many cases necessary. What matters is whether organizations, leaders, and policymakers have the awareness and the tools to navigate them, rather than pretending they don't exist or waiting for them to go away. The research I've done suggests that the organizations that manage this best are the ones that keep people, clinicians, patients, workers at the center of the process. Technology shapes work, but it's the people inside the system who determine whether that reshaping is worth it. Thank you for listening to this episode of Work That Holds Meaning.